Hi, Mrs. Jones, Joe here. You're over 50 and you've got diabetes, so it's important we do vaccinate you. Well, we had 11 patients booked in because that's how many doses we get out of a vial, and they were all over 80, but we still had 4 ring up and cancel. Won't be till well into next year before we get the entire population done. So you swab every patient first.
Like many other GPs across the country, Dr Joe Garra is scrambling to handle a wave of cancellations.
They're mainly asking about side effects, and side effects are much more common in the younger cohort. If they've got multiple medical illnesses, then they probably should still have the vaccine, because we're coming up into winter soon, so people are going to be indoors more and more chance of it spreading then.
Today, the Victorian government paused delivery of the AstraZeneca vaccine for people under 50 for 2 weeks, leaving GPs in that state uncertain of what's next.
No, there's been no mention of GPs getting Pfizer. Out of 10, I'd give the rollout probably a 5. I mean, I think we're doing the best we can. All GPs want from the federal government really is more vaccine and less red tape.
Some GPs have expressed anxiety about being held legally responsible if patients experience side effects from the AstraZeneca vaccine. But the federal government is encouraging them to continue the rollout.
I want to make something very, very clear. Australia already has vaccine indemnity agreements in place. So no doctor need worry. I am saying this on behalf of the government, but also on behalf of our legal advice.
This is a major setback. It really does put a lot more pressure on our public health systems.
Infectious diseases expert Dr Michelle Anandaraja is from an advocacy group representing frontline pandemic workers.
I think the priority is to actually complete vaccination of 1A, the first responders. This is incredibly important, and of course people in aged care.
We're getting daily questions about what's happening, when's it happening. It's making us feel like we're not meeting our duty of care by not being able to get vaccinated.
There we go. Great, thank you.
All aged care residents and staff were supposed to be vaccinated by now because they're part of the highest priority group.
How good, thank you. How are you?
But Glenview Aged Care CEO Lucy O'Flaherty says they still haven't received their jab.
So 77% of our staff are under the age of 50, but for us that means that we've got a significant proportion of our staff and volunteers who actually don't meet the criteria for AstraZeneca, so we need to have some answers quickly to find out what's happening around the Plan B for the Pfizer vaccination.
Residents have been told they should receive the Pfizer vaccine by the end of this month, as originally planned. But there is no timetable for vaccinating staff, and it's not clear which vaccine they'll get.
Bit of rivalry.
I'd personally prefer to receive the Pfizer vaccination. Yeah, I was quite concerned not received with the information on the AstraZeneca personally, just given family history as well. That is a big concern for me.
Roll up your sleeves and get the jab. Make sure that if you have concerns about a particular vaccine or any of the procedures, as would normally be the case, please discuss that with your normal GP.
But some argue that's not as easy as it sounds.
So I haven't been vaccinated, and I did try. I then got a phone call the other day saying because I'm under 50, they're having to cancel it. So I wasn't given a choice. I was just told that they were cancelling it and I'd get a call back.
If Pfizer jabs, which have higher efficacy, can be sourced for frontline workers, Dr Anandaraja thinks the shift away from AstraZeneca could be a benefit.
Because it means that frontline healthcare workers will now most likely get the Pfizer vaccine, at least those people who are under the age of 50. This vaccine has really emerged, along with the Moderna vaccine, as I guess the leaders of the pack, both in the field as well as in the clinical trials, in reducing, severe disease, hospitalizations, symptomatic infection as well as asymptomatic infection.
A slower vaccine rollout is another blow to the struggling tourism industry, especially for destinations that are dependent on foreign visitors.
We are all very eagerly anticipating when we are going to see international borders reopen. We're all preparing that it's possibly not going to be until next year. I think it is a huge concern if we do see that a vaccine rollout will start to slow that down, and it could push it out even further.
Capta Group operates wildlife and attraction parks in tropical North Queensland. Pre-COVID, about 70% of its visitors were international.
I think obviously the vaccine rollout is going to be key to reaching international borders reopening yet again. However, we can't be solely reliant on just the vaccine rollout. Certainly we need to be looking at other international travel bubbles opening up as soon as possible.
Back in Hobart, every day without a clear vaccine strategy puts more pressure on the aged care sector.
Morning, Kate. How are you?
After the announcement over the weekend from the Prime Minister, we would expect to have received something by now, but we don't. So we've spent countless hours that are ordinarily client-facing hours trying to support our staff to understand why they're no longer a priority in the Commonwealth Government's eyes.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.